sleep is an important ingredient in good health. And it's something that we are increasingly understanding and recognizing. More and more men are discovering that they have sleep apnea. Sleep apnea is a condition where a man is not getting enough oxygen because he's snoring and his airway is closing up, but it's not severe enough to wake him up. And so he'll go through the night unconsciously suffocating. This causes a lot of harm to the body for obvious reasons, but we didn't realize just how much harm it causes. It can lead to the development of high blood pressure and aggravate diabetes. It also interferes with our sexual health because when we are in our deep REM sleep, that is when our pituitary gland up here in the center of the brain releases the signals to our testicles for them to produce the testosterone that we need. And if we don't go into that deep REM sleep for enough hours a night, we're going to have an insufficient amount of stimulation of testosterone. And in fact, people who have sleep apnea don't get into that deep REM sleep while they're suffering from the apnea in the middle of the night. Or people that just don't get enough sleep because of their schedule. Night shift workers or people who are just burning the candle on both ends, have to work double jobs, what have you. And so people who have insufficient sleep or whose sleep is being short-circuited by sleep apnea have been found to have lower than normal testosterone levels. And low testosterone can aggravate sexual function. It results in more difficulty getting and keeping erections, not to mention a decrease in sexual appetite and sexual desire. So the other thing that happens with sleep apnea is because the body is under stress, not getting enough oxygen, even though the person is not conscious, while they're unconscious, their body is releasing adrenaline to cope with the stress of the lack of oxygen. And that adrenaline carries out into the day. And men can have erectile dysfunction because they have too much adrenaline in their system. Typically, that's associated with what we call performance anxiety, where psychological stress causes the release of adrenaline. But regardless of the cause of excess adrenaline shuts down the flow of blood to the penis. And it does that because it's trying to conserve blood for the vital structures like the heart, lungs, liver, and brain, because we release adrenaline really to cope with the physical stress, some sort of an attack or an accident that we have to survive. But if we're releasing it inappropriately, our body is still reacting as if there's some physical threat out there. And it does that by conserving blood to our core and drawing it away from the less necessary parts like our penis.